Hi, I'm Dr. Jim DeBlasi, and I am the patient coordinator for my clinic, Regenerative Cell Therapy of Georgia. And right now we're going to be discussing a new solution to pain. But first, I want to give you some rules. Please, if you do have a cell phone, please silence it. The more you pay attention to what I'm going to be talking about, the better and quicker and easier your decision making is going to be. Because I want to try to help you as best as I can, and that's why I'm giving you this information. However, if you do have a question as I am going through these slides, on the back of that piece of paper that I did hand you that's on the clipboard, just write down your question. Usually what I found is within one or two slides, the question is answered. So if you do write down a question, and then I answer it during the presentation, if you'll just put a line through it, so that this way we don't have to talk about it when I get back into the room. All right? So I appreciate you doing this with me. So let's discuss. My purpose and my mission is to help you live a longer, happier, healthier, and pain-free life. Wouldn't that be nice? That's my plans. See, for 41 years I've been in practice. And for the last probably half of that time, I got frustrated. I was doing better work than I did when I started, but people weren't holding their visits as long. As they were getting older, they weren't able to go longer in between seeing me. I had to figure out a solution. That wasn't okay with me. So I had a mission: discover a solution to this problem. I've done a lot of training, studying, reading. I've talked with scientists, PhDs, all kinds of doctors, just to discover the solution. I worked with a lot of patients to try to find, how can we fix this? So when I found the solution, guess what I did? I hired a nurse practitioner and a medical doctor to work for me so that we can then use these protocols that our senior medical advisors, these specialists, gave us so that we could help more people. Again, my mission was to help as many people as possible to have a longer, healthier, happier life, and to also be pain-free. So, a lot of you are going to say, okay, what is this going to cost? Well, I pride myself on having affordable programs. And these have changed so many lives to date. So I hope that you're going to join with me. So let's begin. Watch this little video. Kind of explains a lot.
We choose to go to the moon in this decade and do the other thing. Not because they are easy, but because they are hard.
We choose to do it, not because it's easy, but because it's hard. Our vision is, within a decade, the trajectory of health will change.
Medicine is moving at such a fast pace right now.
Everything in medicine that we know now is going to change. Surgery, pharmaceuticals, well, now we're in the age of cells.
Cells will represent to doctors a much safer and more effective and sustainable way to treat all diseases that involve degeneration of tissue. So that's just about everything.
Exosomes will be very important in regenerative medicine because very similar to stem cells, they regenerate. They like to fix things.
That's what they do. They signal your tissues in your body to heal thyself.
Pope Benedict was very smart, and he really embraced science and how we can improve human health. The grand vision is to use cell therapy, stem cells, immuno-oncology using other cells of our immune system, natural killer cells, T cells, and then gene therapy. What interested you about stem cells?
Oh, the technology is incredible. 15 years ago, I would have said this is science fiction stuff, and it's with us right now.
In vitro fertilization was considered a wacky idea. Now it's something that we use every day and we take it for granted. Soon we'll see the same thing with stem cell therapies.
It's a giant shift in thinking in the concept of being a physician and a healer. And you can never just go back and say, I'm going to go back to my old life. I'll do surgeries, I'll write prescriptions. I can never do that again. I've already seen the other side.
5 years from now, majority of illnesses will be treated by stem cell, and any medical doctor coming out of any medical school must learn stem cell, otherwise they will be left behind, period. We are a part of creating history.
And that is very true. Things are changing at such a fast pace and I'm constantly keeping up with all of this. And luckily, my fellows are helping with this too. We all see the need and the specialty that this is bringing back into the world. So again, my office name is Regenerative Cell Therapy of Georgia, as you know. And this is Harold, one of my patients who couldn't sleep at night because of the pain in his shoulder. And within just a matter of weeks, the shoulder pain totally quit. And he's been able to enjoy his sleeping now because he definitely needs it. And if you go to my site, you'll see a lot of patient reviews. And it's been unbelievable, the results that we're getting. So, let's really begin. Do you guys remember a time when all things that you wanted to do, you could do? Do you remember that? Do you remember that you could fall down and get back up again and play again? Remember as a kid? Well, what about today? I heard horror stories. People who can't even play 3 holes of golf. And then for a week they're in so much pain, but they love playing golf. So they do it again and again and again. How about those of you who can't walk? I've seen some of you not being able to walk even when you go to the supermarket. Can't walk to buy your foods. A good friend of mine couldn't play tennis. All because his knees were destroyed. He got it back, and he's playing tennis. How about those of you who can't play with your children or your grandchildren? How about those of you who can't do any more gardening? Yeah, these simple things in life can be brought back. But you have to do the right thing to bring them back. So, let's discuss it. If you've been diagnosed with a bone, joint, ligament, tendon, muscle, or even a nerve problem, the information that I'm giving you now is going to change your life. So, if you look at these problems that you have you noticed that you are getting into unhappy moods? You're becoming irritable? You definitely know your energy is reduced. You've restricted your activities. But have you noticed you became a burden to your family? And it's interfering especially with your sports and exercise. See, it's reduced your enjoyment of life. That's what I want to get rid of. So, all of your symptoms are pointing to one important fact. You've not been treated successfully. See, to me, that's simple looking at things, logical. So, if an oil or check engine light came on, would you just put tape over the light so you couldn't see it? I hope not, because you're going to be doing more damage and it's going to cost you more money if you don't get that area fixed. Well, the same thing happens with drugs. When you take a drug, medication for a problem, the problem is still there. It's just that you don't feel it or see it. And it's actually making your problem worse. See, if your body was telling you not to move your shoulder with pain and you move your shoulder, you're destroying the shoulder, making it worse. All right? I would imagine that you've tried to use some type of medication to solve your problem. So if I asked you, you'd probably say yes. But in fact, the non-steroidal, anti-inflammatory drugs, these over-the-counter things, Advil, Aleve, etc., make you feel less pain. But over time, they're destroying your cartilage. That's what you were trying to help. But now you're destroying your cartilage. You just made it worse. All right? The opioids, oxycodone, fentanyl, they're going to reduce your pain. But they are addictive. Opioid drugs are now killing 1,000 people each week. This has got to stop. This is killing more than automobile accidents. Some of you are using much safer, the essential oils and herbs, just to relieve the pain. But this is not fixing the degeneration like the procedures that we use that regenerate. Have you heard about cortisone shots? Of course you have. Look at what the Mayo Clinic said in 2017. Taking cortisone shots have joint infections, nerve damage, thinning around the skin of the injection site, temporary flare-up of pain at that joint, tendon weakening or rupturing, thinning of the nearby bone, it's known as osteoporosis, or death of the nearby bone, known as osteonecrosis. This is what's happening by taking cortisone. We've got a bone here. This is called a femur head. This is the bone of your upper leg, your thigh bone. And this is pretty healthy. That one is not. If you look at that one, you see the spacing where you don't see it here. See, that bone is dying. It's got osteoporosis and leading to osteonecrosis. It's dying. And that's why there's so many hip fractures today. But really, how many cortisone shots are you allowed? Well, let's take a look. According to the authorities, 3 cortisone shots in your lifetime for every joint. 3 shots in a lifetime. I've had patients come in with multiple. One guy had 17 cortisone shots. That's horrible. Very bad. So, when the drugs fail, up until now, people thought surgery was the option. But surgeries could have lots of complications, plus you're going to be on lots of medications for quite some time because there's a lot of downtime and a lot of pain. And now there's possibility of side effects. So, if I asked you, do you know anybody who's had knee surgery? You're probably going to tell me yes. There's over 600,000 done each year. And you would think it has a good success rate. Oh, let me tell you a little bit of stuff before that. It doesn't last forever. It's got to be redone in 5 to 10 years. And the average cost is $57,000 and up to 12 months of rehabilitation. The sad part is when I get calls from people who are looking to get rid of that pain that the surgery was supposed to do, and it's still there. But even with good insurance, you have deductibles, copay, medications, loss of work, loss of time with your family, all these things that add up finally could be another $20,000 out of your pocket. Doesn't make sense. So let's look at the statistics now. This is by the National Inpatient Medicare Database. So this is based only on Medicare patients. 4,964 deaths due to knee replacements were reported in the first year. If you add in blood clots to the lungs, heart attacks or pneumonia, all related to that surgery, in that year, another 10,000. We're up to 15,000 people now. And this doesn't even include the 17,000 people who were reported to get infections. That's not good statistics. I wouldn't play those odds. So what do we do? Well, let's talk about the new stuff, just like they talked about in that little movie I showed you. I'm going to talk about stem cells. See, stem cells, we were all born with millions and millions of them within our body. And as we aged, we were using them up. That's what made us grow. That's what made us heal when we fell, when we were playing and fell off the bicycle or whatever you were using. Or you were playing soccer or football and got hurt. You used those up. And by the age of about 20, you only had 10% left. Yeah, 10%. You used up 90% of those cells. And that 10% is for the rest of your life. Not for just that time, but for the rest of your life. And we use those up constantly. That's why your body began to degenerate at that point in time, rather than being able to regenerate like it was when it was younger. So this new field in healthcare is called regenerative medicine, but it has an incredible track record. Regenerative means, by definition, to bring into existence again. Means you once had it. I'm going to bring it back. Look at this little guy. This little green lizard is one of the only ones that can actually grow back its tail. Wouldn't that be nice if we cut off a finger and it could grow back again? I doubt that in our lifetimes we're going to see it, but that could be possible. And you know how we know this? Look at these places that are doing research. Almost every major university around the world is doing research with it. I don't have Emory, but Emory here in Atlanta, Stanford, Mayo, Harvard, Cambridge, they're all doing this. Why? Because they see what's happening in clinics all around the world. But see, we're different than most clinics. I'm going to show you in a little bit. But I'm going to now present a solution to degenerative pain-related problems that's not only safe and effective, but affordable. I want you to get back into doing the things that you want to do. Tennis, pickleball, golf, whatever, soccer, whatever it is that you want to do. Why can't we do that? So, with regenerative medicine procedures, we not only reduce or eliminate your pain, but repair, rebuild, and heal those problemed areas. And this taping, which I actually am certified in, is only like a brace. It doesn't fix the joint. It doesn't fix the joint. It's only a brace. So it's going to give you some relief, but it's not going to fix anything. Look at these guys. These are professional players, and they make millions of dollars a year. They can do whatever they want or need. They have the money to do that. And they've all done regenerative cell therapy. Kobe Bryant, Ray Lewis, Tiger Woods, Alex Rodriguez, Peyton Manning, and I can go on and on and on. But I want to talk about this guy, Hines Ward. Very interesting story. Can you imagine being a football player and your entire life is to get to that Super Bowl and play in that game so you can walk around with that Super Bowl ring? That's a lifetime of work. But 3 weeks prior to going to the Super Bowl, while on the field in practice, he gets hit and both of his knees are in major trouble. At that moment in time, he was told he is not going to the Super Bowl. He can't walk. They had to take him off the field. They had to carry him. But see, in his mind, he was going to go to the Super Bowl. And guess what? He went and he got regenerative cell therapy. And if you notice underneath his picture, in 3 weeks, he became the most valued player of the Super Bowl. His team lost, but he was chosen as the most valued player. That's what regenerative cell therapy can do. Other people have done it. Tony Robbins, Mel Gibson and his dad. In fact, there's a very interesting story about his dad. His dad was at the Mayo Clinic. They told Mel that within 4 days, his dad should be dead. Mel didn't like that. Took his dad to get stem cells. His dad was 92. That man today is 101 years old. He's still going strong. And then Mel, he got his shoulders done. Robin Roberts, Good Morning America, she had it done. Janice Dickinson, an actress, and this is just a small little list. But look at Bernie and Billy Marcus. They both had it done. And he helped to start Home Depot. William Shatner. I mean, all these guys. And then a good friend of mine, Josh Axe, and my nephew, Jordan Rubin, he did not get him done. But Josh did because of some problems that he was having. See, people will do whatever it takes to get the right thing done so that you don't have to keep on doing something over and over and over again. We're not getting any good results at all. So, regenerative medicine is a form of molecular biology that deals with the process of replacing, engineering, or regenerating human cells, tissues, or organs to restore and establish normal function. See, we want to get back to being normal. For regeneration to occur, your body needs assistance to rebuild those injured areas. We use these regenerative medicine products and protocols designed to restore your injured and painful areas to as close as normal as possible. Research had focused on stem cells for quite some time because they were the ones that were thought to do all the new tissues in the body. But see, as time went on, we found some other answers. Let's look at something. This is progress. Can you imagine that as being your car today? Okay, well, that's what it started out as. I don't know if we want to call it a car, but that was a steam engine vehicle, right, back in 1769. And then it went to gasoline in 1879. And then in 1884, they did electric. And then in 1899, a hybrid, a gasoline engine that powered a generator to make electricity. And then in 1936, diesel. But we should all remember the space car from the Jetsons. Who knows what the future is going to bring us? There are many people working on bettering our way, our mode of transportation, the same way that we're bettering healthcare today. So, it started with platelet-rich plasma, known as PRP. And a lot of clinics are actually misleading people by telling them they're getting stem cells when actually they're doing PRP. So we don't do that. We do PRP, but we do not label them as stem cells. And the platelets come from your blood. So your blood is drawn, the platelets are gotten, and then injected into the area. But the platelets have a lot of growth factors and there's other substances there that help the healing to go on. And for some of you, that's going to be the correct procedure. That's all. What about stem cells? Well, first of all, we get them from an umbilical cord, from a scheduled C-section birth. So this has to be a live birth, it has to be scheduled, has to be at a certain hospital with certain people there to accept the umbilical cord. And the source that we're getting them from is in very strict compliance with the FDA and the American Association of Tissue Banks. These are highly effective because they're young and they're strong. See, we could use your bone marrow, but that's going to require surgical procedure. And there's going to be complications and definitely going to have side effects from the drugs and everything else because you're going to be on some harsh medications because of the pain. And you're going to have to go through physical therapy, etc., to get everything back in shape. But the problem is those cells are as old as you are. Wouldn't you rather have younger, healthier cells? Yeah. And then the exosomes, like they were talking about in the movie. That's the cutting edge. That's where I am. So we go beyond stem cells. We can use the PRP. We can use the stem cells. But exosomes, that's where the thing really kick-starts the body's healing process. So we're getting actual results much quicker. In 4 weeks, what it used to take 6 months. Yeah. So I want the best for you and your condition. So as we're going through the consultation and examination, we're going to discuss what is the best remedy to help you. I mean, I'm trying to make it as simple and as easy as possible for you. So if we look at a stem cell, it creates these exosomes, and they're 1/1000th of the size of the stem cell. So we can get a lot of them into the injection. When it gets injected, it's going to migrate. It's going to go all over your body. It's going to control the healing process. It's going to go against the death, antiposis, of the cells. And it's going to boost your immune system in that area, all because of the exosomes. So see how much benefit you get from exosomes? All right. The source of the exosomes, because I'm always asked this question, again, we are in compliance to the highest standards of the FDA medical standards. And the lab, the facility that we get it from, is also FDA registered and in very high compliance with the standards of FDA. We're getting them from donated tissue from 18 to 20-year-olds. It has to be done that way to make it and remain ethical. So it'll never be purchased. But because of the genotype, the genetics, and because of the phenotype, the physical happenings of that person from the 18 to 20-year-olds, we can look and see what's happened during their lifetime. We know exactly how those tissues are, how good they are, and how much benefit they can bring to the next person. So let's look at something that happened to one of my patients. She came in with a 0.39 centimeters. That was the space between the shoulder. This is the arm bone. Here's the top of the shoulder. And that was only at 0.39. That's bad. A lot of pain. But look what happened in 6 months. A 250% increase because the cartilage grew back. Yeah, that opening is there. Now there's plenty of movement, no pain. All because using the correct procedure with regenerative cell therapy. So, by utilizing these procedures, we activate those dormant cells and you start to regenerate new tissue. You're reducing the inflammation and you're restoring normal function. See, there are 1,000+ growth factors that control the inflammation, and in these tissues which are transformed, they signal your body to take healing action. Just like one of the doctors said in here, the body heal thyself. So look, you're not only reducing or eliminating your pain, you're not only reducing the inflammation, you're not only minimizing the scar tissue, but you're promoting soft tissue growth. You're generating new bone, cartilage, muscle, ligament, and nerves, all so that your body can get back to being like it was before. So, sure, you can take the drugs and reduce your symptoms, but you will have some side effects most likely. Or you can undergo surgery, if that's possible, but it has complications. You're going to have a lot of medication because there's a lot of pain. Physical therapy, and of course those drugs have side effects. Or you can do what's called logical. Receive regenerative medical procedures that not only stop but reverse your degeneration. So the survey that I handed you out, please make sure you filled out every part of it. Make sure you write legibly so that I can read it. And again, that's the piece of paper I was talking about. If you have questions, you just put them on the back. So when you fill this out, you and I sit down, we're going to talk about it, and I'm going to see how I might be able to help you. I would love to fulfill my purpose and my dream in life. So a lot of times patients have questions at this point, and I'm going to ask you a question. The main question usually that's asked is, what is it going to cost and does insurance cover it? Well, first of all, at this point, insurance does not cover it. Just like for a long time it didn't cover LASIK, the eye surgery. But remember, I pride myself in having an affordable option. So we make sure that it fits within your budget. And when I know the extent of your problem, what caused it, then I can be able to tell you what it's going to cost. This is not a cookie cutter approach. Just because one person gets an injection in a knee, another person might need something else in that injection. Might need less in that injection. I don't know until we sit down and talk. So, another question is, do you need to be tested to see if it's going to be rejected or so? And let me just answer you, no. These are called immune privileged tissues, so these they're not going to react with you. So there is no matching requirements. Again, you have two choices. You can keep doing the same thing, expect to change, and we know what that is. You can try something new to resolve it that has been performing unbelievably well for lots and lots of patients. I would like to offer you the most precious gift that I can, so please take this from my heart. It's a chance to have a longer, happier, and healthier life again. At the examination, I'm going to measure the degree of your injury and review any of your imaging or your films that you bring in. Then I'm going to analyze the amount of motion that's available in that injured area with some other tests that we will perform to make sure you are correct for this type of procedure. Then you and I will sit down, work out what's the best program for you so it fits your budget. But all I ask is that you give me a chance to help you enjoy your life to its fullest again. And please remember that your problems, as time goes on, get worse. So watch this next little movie. It's a good explanation of what you should do.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
I don't know if that hit you like it did me. As I'm getting older, I don't want to be there. I want to be here. I want to enjoy my life to the fullest. I don't want anything to get in its way. I want to be healthy. I do play with my grandson. I do play with my children. And I do play with my little patients who come into the office. And it's fun being with them because they love to come into the doctor's office. And that's very unusual. And why? Because I want to be like this, and they hopefully can sense that. So, I want to thank you. I want you to really think and make that decision. In fact, close your eyes for just a second. Think about when you were young and you could do all those things like we started out this conversation. Why can't you be like that again? I've dedicated my life to doing this. And I hope that you'll take me on and let me help you. So I'll be back with you in just a minute. I want to thank you.